Hi, thank you for being here with us at the European Parliament. My name is Sarah Wheaton. I'm a senior health policy reporter with Politico, and we're doing a roundtable discussion on the future of health policy at the European level as part of the European Health Parliament. And I'm going to briefly kick it over to Joe Elburn, the president of the European Health Parliament, to explain a little bit more about what it is.
Thanks, Sarah. So the European Health Parliament aims to be the voice of young healthcare professionals right the way across Europe. We're broad, so we encompass doctors, psychologists, NGOs, industry, and we even have a Paralympic athlete. We're multilateral, so we've got an initiative at European level of which people all surrounding us today are part of, but there's also initiatives in Portugal, in the UK, and in Germany. But moreover, we're a movement. And today we are 500 young people, and we're tomorrow's decision makers. We are tomorrow's leaders, and we're the people across Europe who want to make healthcare great again.
Well, thank you, Joe. And so we're going to talk about the future of health policy at the European level, particularly post-2019. And we'll start with Commissioner Andriukaitis, who's the Commissioner for Health and Food Safety. And you'll have to forgive me in advance because I'm going to phrase this question in the most provocative way possible.
Yes.
So we've got a lot of smart people at DG Sante doing a lot of important work. There's some fear that DG Sante won't exist in the next commission. But we talk about health in all policies, so maybe better to spread all those smart people around to all the other DGs that might have more money, more influence to better achieve our health goals. Why do we need a DG Sante?
Very provocative question. Can you imagine 500 young people now here around us, health parliament? You know, it will be a challenging issue to send message. Can you imagine that DG Sante will disappear? Unbelievable. Because health is a big issue. It's very big. European Union should be big on big, and health is very big one. Because food safety and health is about what? About our living conditions, about our healthy workforce, about possibilities to improve our capacities, to have a healthy society, to use our public health instruments, addressing demographic challenges, addressing multimorbidity, keeping people as healthy as possible. How can you imagine to do it without DG Sante? Sorry.
Rui Santos-Ivo, you are the head of Inframed, which is Portugal's drugs and medical devices regulator. Do you think that we need one single DG at the European level handling health issues?
I certainly believe that DG Sante is very important to exist at European level. We see that DG Sante is also a result of an evolution of the process in the EU dealing with health matters. So I think this will be of benefit for all the member states to have a department in the EU that contributes to the challenges that exist. As the Commissioner has said, I mean, we have many challenges ahead. It's not only the sustainability of health systems, which is something very critical for all the member states. We have to find solutions to be able to deliver the best quality health care. But also we have challenges which are clearly linked to people, and when it comes to the increase in chronic diseases, to the growing of elderly population. So all these issues, I think, regardless of what we have to do at our national level within our own remit, I would believe that the existence of a body which is an evolution in the EU, it's very positive. And I think, of course, when we are being challenged now by the young people participating in the European Health Parliament, I think it would be difficult to understand that this would not be the normal evolution of the EU.
And Adina Lone-Valiant, you are not just a member of Parliament, but you are the chairwoman of the ENVI Committee, Environment, Public Health and Food Safety. You know, you work a lot with DG Sante. You probably also work with other DGs that deal with health issues. Do we need a single DG Sante in the Commission?
if someone would say the different, then I think the European Parliament will plead for having a DG Center, because we need an integrator of what is needed to bring the European added value in our health policies. Of course, we know that it depends on the member states how they organize the system, but there is added value at European level if we think at rare diseases, platforms of cooperation and the exchange of best practices, methodologies. If we think at the antimicrobial resistance, we can't fight this kind of challenges in each member state alone, or maybe we can, but then it won't be the same force. And I think DG Sante is needed as an integrator for the added value in health policies.
Are there any changes you would make to the DG to make it more effective in what you just described?
Well, maybe start thinking about giving it more power. But the problem is not in the European Parliament. We have to speak more with the member states, and we have a minister here. I'm sure since the ministry is here, it means they are also progressive in thinking. The idea would be that the member states would understand better that if they share the information, if they put in common the work and rely on the expertise in DG Sante, then we can do more and better at European level. And then we have the agencies, which are also under supervision of the Parliament, but the DG Sante is working with them, and we need to reinforce our agencies also, because there is a lot of work to be done there, and someone has to look into that and do day-by-day job on this, so we need DG Sante, if you ask me. So if someone would say different, then the European Parliament, I'm sure, will argue in favor of having a DG Sante.
And what would you like to see change in DG Sante to make it even more useful to the member states?
I mean, I'm in line with what has been said by the chair of the ENVI committee. I think DG Sante is contributing together with member states in areas where there is an added value to work at European level, and so in this way I think this is positive. I know that there are specific areas where we are now very much concentrated, we as member states, and we are trying also to find solutions. But I think these solutions probably will benefit from coordination with DG at EU level. I'm talking specifically about issues related with technology, health technology assessment, when we have now these collaborations at different national levels. We have different groups that are working together, like La Valletta, like Benelux, like Visegrad, like the Baltic countries. So all these initiatives are aiming at responding to needs that we have. This is, of course, they are focused on assessing and negotiating pharmaceuticals and medical devices, but I think there will be areas, like in prevention, like in vaccination, where, for example, DG Sante can help, but also in this, and of course this is a little bit now linked with the proposal that the Commission has put on the table to be discussed on health technology assessment. So I think it's relevant that all policies take into consideration health issues, but I think it's a benefit that there is a DG which is clearly focused in dealing with these issues, and of course knowing that the member states have the responsibility to run the health systems, but I think that at EU level we will have, and I completely agree, that we will gain if we can work together. So from our side we see positive, and I think the evolution that we've seen if we look back 10 years or 15 years, went from Sanco to Sante, and now to maybe a different acronym, I don't know. It will be certainly a positive for the entire union, as I see it, and I think this is how we in Portugal see this.
And I'm glad that you brought up the HTA proposal. Commissioner, maybe you can just take a few minutes to explain that very briefly. And what have you learned? It's a bit of an assertive proposal for more EU-level integration on health. And what have you learned from the reaction to that, of what people would like to see as the future of your DG?
From society, point of view, society is very positive about possibilities to have access to innovative treatment, to know what does it mean innovation, and to know what it is when you're speaking about treatment. It creates additional therapeutic added value or not. Society is very much involved to have access to treatment, timely access, and it means that we need to address those issues together. And I have a lot of debates about those topics. But you know, we are not starting now. We have 20 years experience of voluntary cooperation. Now we have a lot of experience in this area, and it shows that it's time to establish constant, permanent mechanism to cooperate in this field. Like, for example, EMA, European Medicines Agency. Before, you know how many were rumors about that, oh, EMA, it will be disaster, you know, it will take some competence from member states. Now, please ask people and member states, governments, who will be against having centralized authorization on the market of medicinal products. It helps us to have really good treatment in our hands, and of course it creates a lot of opportunities now to treat very complex diseases, and health technology assessment can help us to go in more effective way designing what does it mean innovation and proposing to our people better way to achieve a good treatment, and they are in favor. Member states also have the same view, more or less. Biggest majority of member states more or less have the same positive approach. Some are reluctant because they have some different views on different very specific topics, but it's time to discuss those topics. And I know that European Parliament also is very in favor to move in such direction, because their resolution was adopted asking Commission to present proposal which can allow us to establish permanent, constant mechanism based on compulsory uptake and compulsory participation.
And Joe, from the perspective of the European Health Parliament, where do you see the trend going as far as what the next generation wants to see at the EU level?
So I think it's pretty clear that there's a fundamental imbalance between supply and demand in healthcare. There's way more old people, there's way more chronic diseases, and the healthcare systems are pretty much doing exactly what they're doing. And it is completely impossible that we continue in business as usual. And obviously, it requires more resourcing in some way. And how do we do that? I'm sure some smart people can come up with that. But more than anything, it requires cooperation at European level. The fact that the question of the existence of DG Sante is on the table, I think, is absolutely ridiculous. And we, as young people, we just will not accept equivocation and roadblocks and barriers in making healthcare better. And that means that we need to be able to move around countries. We need to move data easily. We need data infrastructure. We need to have, we can't be in a situation where one country has a load of vaccines and another country doesn't have a load of vaccines. That's just because they don't comply with some kind of regulation. We can't be in a place where healthcare professionals can't travel from one country to another to plug demands. I mean, the list is endless. All of it requires cooperation, and at European level, and we've got to get away from member states guarding this healthcare competency so jealously that they inhibit and make the health of their own nations worse.
Well, you brought up vaccines, and I know that the Health Parliament has really been looking at ways to improve vaccine coverage. What, I know it's still a bit early, but are there any conclusions or kind of good ideas that you've heard so far?
Absolutely, and there's a big list of ideas which I hope people will read once we release these in April. The great work of the committee and the committee chairs. I'm just going to pick one of the vaccine recommendations, which is to empower pharmacists to give vaccinations, but not just sort of the flu vaccination, a whole plethora of vaccinations to populations. Portugal is a great example of this, where they've done some amazing work in the last few years to really change that calculation. And I think that it's an absolute shame that measles has increased 400% in the last year. 400%. And this is a thing that we can cure. It's doable. It's like smallpox. We can cure it because we have the vaccination. And because of vaccine hesitancy, because of a lack of supply and demand, because of member states not empowering and making the right decisions, we now have more measles than we did in 2016. And that is totally unacceptable.
Well, you brought up the Portuguese example, and I'm wondering, Rui, if you can tell us a little more about how that's been working for you with the pharmacists, how you sort of convinced people that they should be comfortable getting vaccines through their pharmacist.
We have a for a long time established a national plan for vaccination, which is run by the Ministry of Health. It's 50 years since it's in place, and of course this plan has shown very important results when we look to infant mortality rate, where we have one of the lowest in Europe, which we are very pleased, and we see this as very much a result of having established so early this plan. But of course we also see, as Joe said, that there are needs to improve and perhaps extend the utilization of vaccines where they are needed. And what we have put in place is to allow pharmacies as a complement, in addition to what this national plan, which is run within the health system, within our national health system, to complement this vaccination plan. For example, in flu vaccine, it's very important. I'm sure, and this year was a very big example, that this has helped a lot to vaccinate the populations, the groups of population which need, because we have approximately 3,000 pharmacies, and so they are easily at reach. So this is something that has been evolving, and we are currently looking a little bit to the issues of what services pharmacy should deliver. Of course, this is established, and we want to extend, and we see it as a very positive move. So in terms of the outcome, and of course it plays a role in many areas, but it can be extended. So this is the kind of experience that I would see as useful to be looked at, and of course we are fully ready to contribute to that.
Mm-hmm. Ms. Valian, Romania, unfortunately, is kind of one of the epicenters of the measles outbreak. Can you help us sort out what maybe are issues unique to Romania that are fueling that versus areas where the EU could actually be helpful?
So the problem of vaccination has two aspects. One aspect is the reluctance of parents to go and vaccinate their children for a variety of reasons. The last of it is it's sort of trendy not to believe in vaccines anymore. And the second topic is the availability of vaccines or national programs of vaccination. So these are two main topics which are, I think, these are general for any country which has problems with vaccinations, reluctance, and then there is a variety of methods someone can apply, as I think it was already indicated here, from obligation to vaccination. Because, for example, in Romania, I would say the problem was the dropping in the rates of vaccination for measles. That was, I think, maybe the most important cause for that. And then the availability, when I say the idea of having the vaccines available in pharmacy, because if the doctor tells you you should vaccinate your child, but then you have to wait a couple of months until the national program of vaccination or the vaccine is available, it does not make sense. And I think countries in which the rate of vaccination increased, like UK or Spain, have this kind of method applied. But it's, well, and others, of course, they have the compulsory. They have to Well, I don't know if the stick or the carrot is the better method, but I know for a fact that we need to do something, and I think that is particularly something in which the European institution, the DG Sante, is also involved and has a role to play together with WHO to convince member states and governments to step up on their measures to tackle this issue. Yeah.
And Commissioner, indeed, you're working on an action plan proposal for vaccination. Can you update us, and what are some of the ideas that you've arrived at that you're most excited about?
Now we are in process to see public consultations on our future proposal on communication on vaccination issues, and I ask all to be involved, because we need to have broad debates from a public point of view. And of course, as all mentioned here around this table, that we need to, first of all, to see how to address shortages in vaccine supply, because if vaccine supply creates a lot of problems on the ground, then we have no instruments to react quickly. Second, we need to have data in all 28 member states. It means that we need to have real IT tools now to communicating within all 28 member states and being very responsible on possibilities. Yes, we know in this country those shortages are there. We can support, we can communicate with different countries, organizing possibilities to help country address those issues. Of course, we know very well that we need to have also broad, harmonized approaches, speaking about our national vaccination calendars. Now we have more than 30 million people who are working in different countries, and they are traveling with their children, their families. And sometimes, not sometimes, it's in one country you see one vaccination calendar, in another. In one you have no chance to vaccinate because it's too early. You come into different country, it's too late. And okay, but you know it's gap, and your children are within this gap. You can ask member states, please look, we are not living in 40 years ago. Now Schengen area is we are all together, and free movement is so intense that we need to harmonize our calendars together to addressing common challenges and issues.
At least make it clear so that a citizen would know, have the information. Well, so if I'm planning to go to Germany for 2 months with my child, just to make sure that, I don't know, it's required that I would have the vaccinations. If not, if it's something going on, then in this country I don't find, in particular, that vaccine, or I don't know. So at least the information, and that's why I think DG Sante, with the information and the power to correlate between ministries, can have a very important role to play.
To have e-tools, IT solutions to communicate, to help and to address.
I think this is what Commissioner Andriukaitis is saying is a good example of where we could better coordinate at EU level because there are the two aspects: the accessibility and or the availability of vaccines, which requires a good planning, and also, of course, the information. And here I just wanted allow me to stress again that pharmacies also, and Dr. Valina has mentioned this, that it's very important, the literacy, the health literacy that and information that we put in this area of vaccination. Of course, here the members of the European Health Parliament, that will be the future fathers, will have an important role. And I think here also the network of pharmacists to be more involved, I think, will be clearly very positive for the vaccination activities.
And just to put a fine point on it, so Portugal would be willing to adjust its vaccination calendar if there's a decision at the EU level?
I cannot tell you, but I think it's worth to discuss the coordination, and because we want to move around, we want to have the information, probably even the knowing where to find out all this information is important, and I know that Commissioner is very keen on spreading this information. So I think it's relevant to discuss, certainly.
And we have about 5 minutes left. I just want to touch on one other thing. Portugal is part of the Valletta group to do joint procurement. Can you give us a little update on how that's going and if you think it's going to be effective at improving access?
This is our purpose. It's both to improve access to patients, because it's the first obligation of the health systems, and to ensure that the innovative products are accessible, and also, of course, to contribute to the sustainability, because this is a fact. We know that the new products, the new medicines, the new important medicines, innovative ones, a lot in the oncology area, in the cancer area, many are very important, but also very expensive. So we are pursuing these two objectives: access plus trying to have a good negotiation together. We are now 10 countries. We had our last meeting in Madrid. We were quite pleased to see that now we are 10. We have now Croatia and Slovenia, apart from the other 8 where we have that start from the beginning: Portugal, Spain, Italy, Malta, Cyprus, Greece, Romania, and Ireland. So we are very focused on going concrete, on discussing in concrete needs that we have. So we also are expecting that we will have collaboration from the industry, because it's industry that has the product. So we are now conducting 2 assessments already, and we are positive in expecting that this will be delivering good outcomes for the systems.
What are you assessing?
I cannot tell you, but we are assessing. One is an orphan product, the other is not an orphan. It's for 2 important diseases. I cannot tell you which ones, but I hope that at the end you will see which ones we assessed and we negotiated, because it's very important that the negotiation part, and this is something that is part of I think the other exercise as well, but the Valletta particularly is aiming at negotiating for the entire group, which is a big part of the EU population, of around 160-something million, so it's quite important.
Yeah. Joe, is this something that the European Health Parliament has their eye on?
I think that we're looking at the concept of value-based healthcare, which is we should be measuring not the sort of morbidity, mortality, which are all important, but we should be measuring things which are the most important things to patients, and that should be divided by the costs of delivering those outcomes. And I think our view at the moment is that the healthcare systems are obviously highly siloed in terms of budgeting, and we want to encourage new ways of thinking about this, so that we're starting to see shifts from areas of overspend to areas where it actually makes a lot more sense and delivers a lot more value. So community care, for example. And that's what we're looking at in terms of the healthcare system piece.
I'm sorry to cut you off. We have 2 minutes left. I want to give everybody one last minute to talk. How does this kind of value-based care question, how might it be different in Romania versus, say, here in Belgium?
Well, I don't want to speak necessarily on Romania's behalf, but it is the dilemma between the need for innovation and the value-based care and the affordability for the citizens. So it is a problem, and I think we need to be very innovative in what we are thinking. Maybe the industry can look at a bit of a change in their business model. Maybe the revenues won't be linked on the number of units sold. I don't know. Maybe on different ideas. We have to put more money in research and innovation. Maybe have the innovative medicine in Horizon 2020. Try to have both push and pull incentives for both for industry to innovate, and then for governments to find solutions for affordable care for all the citizens. So we still
I'm going to let the Commissioner get a last word, and we have about 30 seconds left.
Okay, only speaking about possibilities how to really join our forces. Today it's a very big mistake when innovative models are in one hand, reimbursement models in another. Now we need to invite all together, because we need to bridge such a gap between different models. Otherwise, we always can see confrontation between high prices, innovations, and then patients' access to treatment. We need to now to break silos and put all together and have all mechanisms on the table, discussing how to connect different models, presenting more collaborative approach in innovations and reimbursement issues and financial issues.
All right, well, Commissioner, thank you so much for being here. Rui Santos-Zivo of Inframed, MEP Adina Iona Valean, and Joe Alburn of the European Health Parliament. And thanks to all of you for watching, and we'll look out in April, right, for the European Health Parliament's recommendations. All right, thank you for joining us.